Welcome to Getting to Work. It's the podcast of NCI Works. I'm John Spencer from Starved Rock Media with two very special guests today talking about something that affects all of us, healthcare, and in particular in our workforce area, much of it rural healthcare. Pat Shao is the executive director of ICANN. That's the Illinois Critical Access Hospital Network. Hi, Pat.
Hi, John. Thank you for inviting me. I look forward to our discussion.
I enjoy getting into this too. And AJ Quesagrosa is the CEO, the strategic leader of the Western region of OSF Healthcare, maybe one of the busiest guys in healthcare these days. Hi, AJ.
Hi, John. Thanks again for having us. We're looking forward to it.
Absolutely. We're hoping to just sort of have an open discussion here and talk about not necessarily what has brought about all these changes, because at the end of the day, it doesn't really matter what caused it. The fact is we're here and now we need to deal with it. And you guys are at the forefront of dealing with rural healthcare in our workforce area. Pat, I want to start with you and your network. 59 member hospitals, is that right?
That's right. Actually, we have 60 now. I added Macomb, McDonald District in Macomb has now become part of ICANN, and it's not a critical access, which is a small rural hospital, less than 25 beds, but it's acts a lot like that, and that hospital would like to achieve critical access status because it's a different reimbursement system and very helpful.
Pat, your hospitals now numbering 60 range from as far north and west as Galena to Metropolis in the very southern tip of the state, from Carthage to Mount Carmel. Literally, you have the entire state covered with
Right.
this network.
Yeah, it's these small hospitals, and they found that by working together and sharing information and education and training and resources, that they could be stronger together and learn from each other. It doesn't matter whether they're independent or part of a system like AJ's system, but they really helps them keeping on top of some of the rural programs and some of the rural services, and really understanding the impact of policy changes, insurance, all these things on rural providers. And there's some uniqueness to being in a rural community.
Certainly. I have grown up in a rural community from down around Jacksonville, and now I've had the fortune of being here in the Illinois Valley for 3 decades or a little more. So I understand the difference. And I've been in the cities too. I spent some time in the Quad Cities and I've had kids that have lived in much larger cities. So there are unique differences. And real quick, I don't want to dive into the past. I swore I wouldn't do that. But Pat, why can't every hometown, small town have its little independent hospital like it used to?
Well, a lot of has to do with resources. What resources do they have? A system like OSF or HHS, other groups like that, they have capital. They have leaders. They have human resources. Sometimes it's hard to recruit people to smaller communities, and so that's why they may connect in with the system. It also has to do with the payers, and I'm sure we'll talk about commercial payers and government payers. There's something to, if you work with payers, there's some synergy of being able to negotiate a contract with 20 hospitals as opposed to one hospital. So that's some of the reasons for that. And the others that are independent are able to do that. They found the strategies that work for them, but they really don't work independently. They really have business relationships with systems or with commercial carriers or other smaller hospitals, because we're not really an island anymore, and we really are really part of a group. And that's why people are part of ICANN or systems, because we need that support. It's a fast-paced world, as we well know, and that's really some of the differences. If you look today as it was 25, 30 years ago, we don't have Marcus Welby around to take care of our needs. We've had to make changes to life. So.
I was thinking about the doctor on Little House on the Prairie, actually, who, would write up. You hoped he was in the area, and I don't know how you ever got word to him. But speaking of busy and fast paced, AJ Quissagrosa, you got to be one of the busiest guys around right now. I know as we're recording this, you were just in Ottawa, brand new YMCA opened there. And of course, there's news that there's a brand new hospital that's going to be built. And you're trying to put this I-80 corridor together, which has its own unique challenges. And then all of a sudden, oh, let's throw Dixon into the mix too.
Well, I would say, John, healthcare is busy. I mean, today, and looking for like-minded people. I think Pat said it really, really well. It's, you know, some hospitals will remain independent for forever. Others will, choose to join health systems. I would say our experience has been, more times than not, unfortunately, to Pat's point, the resources are limited in smaller communities. And, whether that's a network of providers or a network of, you know, the electronic health record, right? One unique health record across. Those things have changed from the days when, my parents were raised in Spring Valley. I mean, the doctor was the local town doctor, did a lot of things, did everything, both inpatient, outpatient, and everything in between. That's just not how medicine has evolved. And I'm not saying that some still don't do that, but today, it's really many practitioners practice outside of the hospital and many practice in the hospital. And, it has changed the landscape of healthcare.
Truly, truly has. The doctor's not coming to the house anymore making health calls. And in many respects, and in fact, probably most respects, if you have a general practitioner, he or she is not necessarily your first call these days,
Well,
right?
John, the only thing I would say is your doctor may not be driving to their house, but remember we have telemedicine today where, I think COVID helped us all adapt to one thing in particular. We became much more comfortable with this just having a Zoom call, right? And
Right.
having the time to connect. But our physicians, our advanced practice providers are doing a significant amount of virtual calls now for people who might not be able to get out of their home. So they get their home care digitally. And don't forget, we have great home care clinicians who come into the house to do that as well. So
But yes, you're right. Many are not even leaving home thanks to,
yes,
thanks
correct.
to this right here. And as we talked briefly before we got started, our kids may not even have a GP. I know my daughter has just changed cities, moving, time zones away, and I'm confident she does not.
Right. And John, that's interesting. We were having this conversation, Pat. I happened to be able to visit our daughter this last weekend. We were talking about general practitioners. She goes, I don't have one. I go, well, you go to the OBGYN. Yes. Well, that's pretty good. I think that's excellent. And, maybe you should have one just in case you need it. She goes, well, I can just go to the urgent care if I have a problem. And so, again, I think there are new opportunities for individuals to get the healthcare they need when they want it, the way they want it. And so I think that's going to continue to evolve as we move forward.
It truly does seem to be a generational thing because again, I know my kids who are 30 something, they want everything right here on this device and it doesn't have to be anybody they know, they're fine. Whereas most of us, Dr. Louis has been my doctor since I moved here. Yeah, I know you'll recognize the
Yep.
name.
Right.
You know, uh, Pat, you see in your network as well more on demand things. And of course, more people just go to that urgent care as the first step, correct?
Sure. Even in our smaller facilities, they do. Almost all of the members that I work with have an urgent care. They have a clinic too. Many of them have clinic for primary care, and that's what's really changed is we have a lot of variety of healthcare providers. And we were talking just the one general practitioner, and then you had the hospital, but now we have a variety of of practitioners and involved in the healthcare. But they often go to urgent care because you don't need to go into the hospital for things. You might need a tetanus shot. You cut yourself, or you have an earache, or a variety of things that you don't necessarily need to come to the emergency department. So what we've done, even in our rural communities as well in urban areas, we've adjusted to it, the needs. And some things we'll be able to do by telemedicine, but you still also need that personal touch, that personal look. And I think that's what our rural communities do well with. I was talking to somebody out in Massachusetts about some issues today, and they were talking about the difference between urban and rural. And we like to think that we're high touch and a little bit low in technology. And that's where our capacities, and reach out to our systems and our tertiary care as technology is growing. And I think that's the biggest impact that I would say over the years is that we still have local care. We still take care of when people break their arms or they're in a car accident and have a heart attack, whatever. Those things don't change. But it's the technology for advanced care, for cancer therapy or immunotherapy, or special diagnostic treatment. Now, it can't be in every little place, every little hospital or big hospital. I mean, we've had to diversify that, and I think that's a resource, and why sometimes we've developed those system relationships. Who'd ever think that you'd have an X-ray done today, and at the same time somebody's reading it, 5,000 miles away. I mean, we've just done a lot of amazing things. People used to have an echogram of their heart, to measure the valvular response in your heart valves. And, it used to take a long time to get that read, maybe 2 or 3 weeks. You had to do recordings. And then we had technology where you would transmit it by the internet, and would take 2 or 3 hours. Now it takes 5 minutes. So, as technology speeds up the diagnostics and other things, and that's why we have so many different providers, we can be very efficient with it. But what we still have to have is that primary care provider. I'd like to push that locally, and that's important. And maybe your daughter, others don't need it now, but at some point you need somebody to help you coordinate those services. And that's why your local provider is very important to you.
Absolutely. AJ, a lot has been talked about resources, and sometimes it is a little bit difficult getting people in our rural areas, isn't it?
Well, it is today, and it isn't just physicians. Um, it's a complicated ecosystem. We don't really we don't think about the behind the scenes people who play a very important role. From I have a general surgeon, right? Well, they're wonderful clinicians, but there are a lot of people behind them, from the sterile processing team to the anesthesiology team to the scrub techs. All of those individuals are in high demand today. And to be able to have them in every location is very daunting at times. And so again, we do work with local colleges to try to build the right programming. I'm very proud of the work that we do across OSF in that. But again, I think these are careers, frankly, that don't get a lot of attention. And we continue to get these out, from our diagnostic imaging techs, right? These are very important, lucrative jobs, and we need to get the word out to get them trained and come into the workforce.
So there are going to be job opportunities. There are job opportunities, is what you're saying.
There are so many that we don't even think about. We always run to the typical, I happen to be a pharmacist. You might be a pharmacist or a nurse or a doctor, right? But there are some incredible people behind the scenes who do just great work. And of course, our nurses are great as well. And it was Nurses Week last week, so we always have to put a plug out for that.
And Pat, that was kind of how you got into this whole thing once upon a time, right?
I'm a nurse by background and training. I started in Methodist Medical Center, which is now part of Carle, worked in Sioux City, and then came to Perry Memorial, which is now St. Clair, and have had my opportunity of watching healthcare change over the years, from being part of first ICUs and then moving into diagnostics. And now our small rural hospitals, we're part of an accountable care organization. And I think so life just continues to change. But one thing I wanted to add about, you talked about resources and workers behind the scenes and how important that is to have good healthcare workers in our communities. And I want to stress that our rural communities have the people, if you're interested in getting into healthcare, talk to your local hospital or physician group or whatever, because there are scholarships and loan opportunities. And healthcare is a good profession to be in. You know, you can do IT, you can do coding, and some things can be remote, some things can be on site. And you don't necessarily have to be a practitioner, doctor, or nurse, or whatever. But, you know, our work now with community colleges are so important. And I think we can do more sharing resources with our community colleges, because that's what keeps us strong. We have to have the base behind there. You know, a hospital, you know, you receive mail, you code, you bill, you take physical therapy, have some people have aqua therapy, you know, you recover from a stroke, you have emergency department, you have surgery. I mean, we name it, and have babies, you know. So
And have babies. That's a lot,
you can have
AJ.
your variety. It's not a dull moment.
Never.
Maybe we should have done this as opportunities in healthcare,
Correct.
as opposed to changes in rural healthcare. I think we may have a follow-up here. One other thing before we wrap this one up, I just want to talk just a tiny bit about proximity,
Yep.
specifically with AJ, because I know you've talked about building a new hospital with OSF in Ottawa, and you're making Peru the hub. And understandably, because a year ago at this time, Peru, Spring Valley, LaSalle, this area did not have a hospital and people were scared to death. And now people in Ottawa are upset because they see services perhaps leaving their hometown. When I think about healthcare in the suburbs and in the city, people still have to travel to get the care that they need. It's not necessarily all in one place. It's just that they may have to drive 7 miles and it takes them 30 minutes. Here, you drive 27 miles in 30 minutes.
Well, you know, John, it is it's a change that I would say over time has been hard for some of our communities to really understand how the original hospitals started, right? That our ecosystems in our towns in the early 1900s, right, were much different. They were very contained units. Not that they aren't today, but we didn't have Amazon, we didn't have Walmart, and we didn't really migrate out of our little ecosystems. When our immigrants came here, you know, over 100 years ago, they stayed in their little units. If you were in Spring Valley, there were 5 Catholic churches in the town. That's not the case today, but but the evolution of that is not any different than we had the similar healthcare ecosystem across what we call the I-80 communities from Princeton to Ottawa, Streator to Mendota, and you had 6 hospitals repeating and duplicating all the same resources, same people, same things, really fundamentally doing the same care. And today that's just not the case. And so for us, you know, we tried to take a situation that may not have been positive when IVCH St. Margaret's closed in January of 23, you know, went through the whole bankruptcy piece. And then the opportunity came to say, wow, Peru sits right in the middle of a very large geographic spread, if you will. And Pat knows the challenges we've had in Princeton, specifically around not delivering babies. And today, a woman in Princeton has to drive an hour
Right.
to deliver a baby. It doesn't matter. Doesn't have to come to OSF, go to the Quad Cities, could go up to Dixon, could go to CGH, or could go to Ottawa today. And so our thoughtfulness around OB in specific, OB coming to the center of these ecosystems cuts that drive in half. It's about 30 minutes should the woman choose to deliver their baby at OSF. And so again, just really thinking about geography, and then of course the limited resources of our physicians as well, trying to kind of pool, you know, a group that would share call responsibilities only at one versus I'm going to deliver at 4 different locations. So again, that was the thought behind it. It wasn't anything greater than that. But I'd love Pat to, we've talked about this, before, so it's interesting times.
Well, OB is very complex because not only you talked about the practitioner, you have to have all the work behind the scenes, anesthesia, and if you have an emergency C-section, all those things have to be available. And when I came to Princeton in the late 70s, Perry Memorial itself delivered 540 babies that year. Now, 8 or 9 years ago, they closed the OB unit because they were about 100 to 120 babies that year. And it's just not enough to keep the skill sets up. However, but, AJ and others and I are working on things across the state. What can we do to fill the gaps? How can we do it through telemedicine, prenatal, postnatal clinics, and then connecting into the birthing and non-birthing hospitals? And so we have to be more intentional about how we start to look at OB care and rural health care. It's just how do we use those resources to their best advantage? And it really requires collaboration and people thinking out of the box like AJ, and how do we get this done and provide changes? Because there'll be changes in another 10 years. We think we fixed it today. And one thing I know that it's constantly changing. And so, this is no different in our area, the Illinois Valley area, as it is down in Southern Illinois and Central Illinois, and they're going through changes, and they have to evaluate their resources, their connections, and how do we really keep our rural communities strong. If not, then how do we recruit people to live in our rural communities? How we have interstates that go through, we have economics, we have farming and all that. Then our economies, as you talked about ecosystems, our economies start to suffer. So we have to have that support system. Healthcare, education are all very important. And so we have to find the resources and put all the pieces together.
I am very thankful that we have professionals like you two leading this. And you both seem very hopeful and positive for the future. So you must see very positive things and another wave or three of people coming behind you, Pat.
Oh, I think so. I have some wonderful hospitals. They're just doing great things with care coordination and how we do a lot of training with pediatric emergency. We just got a special grant from the Department of Public Health to do some training with our rural communities, and so they can have the best. We've worked with OSF and their jump center and things like that. You have to think positive. We have to think, how can we make it better all the time? And it doesn't matter where you live. We want to make sure that when you drive on our highways in Illinois, that if something happens, there's a good healthcare right there. And so our rural communities really work hard to do that. They work on care coordination, emergency services, and their connectivity with their systems and advanced care. And, later on, home health and mental health and behavioral health, we didn't even touch that. So, we could
Come
talk
on.
for hours.
Yeah.
So.
And John, and Pat started it out. I mean, it's around trying to keep our communities healthier as we move forward. And there's a lot of work to be done on that. I know the work that Pat's been doing in Bureau County. We don't even think about the dental needs of our communities. We talk about the medical pieces, but this is a whole body, right? That we have to continue to try to keep them healthy so that we can keep them out of our hospitals for as long as possible. But we cannot underestimate the power of population health, the work that Pat talked around our primary care providers, right? The work that they do trying to keep individuals, even when they have chronic illnesses, as healthy as they must possibly can in that moment. So again, I applaud Pat for all the work that she does in our communities as well, because it takes a village of all of us to try to work together to keep it here at home.
That's right.
And most of us have no idea what's going on behind the scenes, and we're better off for it. So thank you.
And we'll be happy to recruit people too. So, we'll put our plug in there too. We're happy to engage it. But AJ and I've worked with quite a bit the last few years, and it's a pleasure to work with OSF and the communities. And I think that's what's nice to see is how we partner together and how we think and plan together. And just opening this up, your podcast, to let people know that there are people working behind the scenes. We know there are gaps. We know there are issues. And the goal is to provide everybody quality of life. We want want them to drive, we want them to stop and come to our communities, and we want them to live in our rural communities. And that's what we're all about. We live in a rural area and we want it to be successful. We want the best for all our people. So
Pat, what's the website if folks want to find out more about the ICANN network?
www.icahn.org.
Okay, that's ICANN with an H in the middle, H for hospital.
Mhm.
All right.
It's
And
Hospital Week.
what's that? Hospital Week?
Hospital Week, how about that?
Very timely. And AJ, if folks want to find out a little bit more about OSF and in particular the I-80 corridor, you've got that as well.
Right, we do. You can just check our website out at, osfhealthcare.org. And, we're out there continuing to kind of just support our communities here in the Valley. So thank you very much for that.
Figuring it out one day at a time. That's all we
One
can
day at
do.
a time.
AJ, Pat, thank you very much for your time and thanks for all you're doing to help us all be healthy here in the workforce area in the state of Illinois. For all things employment in this area, go to nciworks.org. You'll find other podcasts in this series there as well. That's it for today's edition of Getting to Work.